Thank you for participating in NRCC's campus reopening training. Please follow this training carefully as it contains important information about precautions NRCC is implementing during the COVID-19 pandemic. The purpose of this training is to provide information necessary to help reduce the spread of COVID-19 within the college community. This training is designed to raise awareness about the COVID-19 illness and transmission, outline precautions the college has in place to reduce the spread of COVID-19 within the college community, and review faculty and staff responsibilities to reduce the spread of COVID-19. Details about NRCC's plans and precautions for returning to campus are outlined on NRCC's coronavirus webpage, www.nr.edu/CIU. Individuals infected with the COVID-19 virus can become seriously ill or die. COVID-19 illness is caused by a novel coronavirus, one of the families of viruses that also cause the common cold. And it is spread from person to person through respiratory droplets containing COVID-19 virus. Because this is a novel virus, the scientific understanding of the virus continues to evolve. However, it is likely that COVID-19 exposure occurs most frequently between a sick individual who coughs or sneezes within close proximity to others, within about 6 feet. Droplets containing COVID-19 virus can also contaminate and temporarily survive on surfaces. Individuals can become ill by touching a contaminated surface and then touching their nose, mouth, or eyes. Current research suggests that this type of exposure is less common than person-to-person exposure. However, it is important to maintain a clean work environment to prevent the spread of COVID-19. The college is increasing cleaning routines to disinfect frequently touched surfaces. Employees should wipe down or disinfect their personal work areas when they begin work and again when they leave their workstations at the end of the scheduled work time. Employees should also observe rules of social distancing and maintain 6 feet between individuals. Most importantly, wash your hands frequently. Practice good hygiene. Wear your face coverings in open areas of the college and remain home if you feel unwell. These practices, combined with the use of face coverings and physical distancing, can slow the spread of COVID-19. Individuals who become ill with COVID-19 report a variety of symptoms ranging from no or mild symptoms to severe illness requiring hospitalization. Symptoms of COVID-19 can include cough, shortness of breath, difficulty breathing, fever, chills, shaking, muscle pain, headache, sore throat, and loss of taste or smell. Other less common symptoms reported include nausea, vomiting, and diarrhea. Consult your medical provider if you experience any of these symptoms or symptoms that concern you, and do not come on campus. Symptoms typically appear 2 to 14 days after exposure to the virus. A person will remain infectious for up to 72 hours or 3 days after symptoms improve. Research suggests that individuals who have been exposed can be infectious even when they show no symptoms at all, also referred to as asymptomatic. For the protection of others, it is important that you take quarantine precautions if you suspect or know that you have been exposed to COVID-19. Quarantine means remaining at home, avoiding others and public locations as much as possible for 14 days after a suspected exposure. COVID-19 illnesses can result in serious illness or death, especially among individuals who are considered high risk. You might be considered high risk if you meet any of the following criteria. You are 65 years of age or older, have a compromised immune system, have a chronic health condition such as a serious heart condition, diabetes, chronic lung disease or moderate to severe asthma, liver disease, chronic kidney disease or undergoing dialysis and/or severe obesity with a body mass index of 40 or higher. High risk also includes faculty, staff, and students who are recognized as high risk per the CDC guidelines due to their own health conditions, as well as faculty, staff, and students who live with or provide care to a family or household member who is at a higher risk for severe illness from COVID-19. Individuals who are at high risk are strongly encouraged to make arrangements to telework and minimize the amount of time spent on campus in order to reduce their potential exposure to the COVID-19 virus. Employees with heightened vulnerability due to age or underlying health conditions will be given consideration through flexibility in teleworking. NRCC is committed to avoid the stigmatization of vulnerable populations, individuals who have contracted COVID, or other affected populations. When you are in close proximity to other people, on or off campus, there is no guarantee that you will not become infected with the COVID-19 virus. However, the college is implementing a variety of public health and precautionary measures to help reduce the risk of transmission. Collectively, our actions can slow or prevent the spread of COVID-19, but we must all do our part. NRCC's public health measures and precautions include conducting a self-administered screening assessment of symptoms or contact with a known COVID-19 case or cases, and contacting the New River Valley Health District for advice on testing or other protocols. Staying home if you are feeling sick or are experiencing symptoms. Modifying instruction and work routines to reduce exposures. Implementing physical distancing measures in all campus environments. Implementing the use of face coverings. Requiring safe distancing for all faculty, staff, and students in work areas and classrooms. Increasing cleaning of college spaces. Posting public health and safety signage. And erecting wellness shields between people in some areas. Instructional continuity plans are being developed to implement public health and safety precautions in college classrooms. NRCC is modifying how we deliver in-person instruction to reduce the spread of COVID-19 on campus. Some of the ways that NRCC is making classrooms safer is by reconfiguring classrooms to reduce occupancy to allow adequate separation between instructors and students, and between students. Reduction in classroom occupancy requires the college to be creative in how instruction will be delivered in the fall. Additional online courses are being offered to account for reduced classroom occupancies. To mitigate exposures on campus, NRCC is modifying the way we operate to promote physical distancing. Personnel who can work remotely or telework should continue to do so until further notice. However, some faculty and staff may need to return to campus to provide critical support to college operations. Faculty and staff will be instructed by their dean or supervisor when they are expected to return to campus after the necessary planning and precautions for their work areas are finalized and as conditions merit. The college has developed a staged approach to systematically resume campus operations. Physical distancing precautions are being implemented in all college environments. In order to maintain 6 feet of physical distancing between individuals, plan for sufficient separation between desks, workstations, computer terminals, cubicles, reception desks, seats in waiting areas, and individual study areas. Meetings should continue to be held virtually if possible. In addition to teleworking, staggering or otherwise adjusting work schedules, faculty, staff, and students returning to campus will find many changes as a result of campus-wide efforts to provide appropriate health precautions and prevent potential spread of COVID-19. As has been widely publicized, the primary way to prevent the spread of communicable diseases is through physical distancing, commonly referred to as social distancing. Physical distancing precautions will also be implemented in restrooms, common areas, and other environments throughout campus. Please observe signage indicating new occupancy limits and which spaces can and cannot be occupied. We recognize that these precautions may create challenges and inconveniences. Please keep these changes in mind as you return to campus and plan accordingly. In accordance with CDC recommendations and public health and safety precautions, All students, faculty, and staff should wear face coverings whenever in shared offices, common areas such as hallways, classrooms, public spaces in all college buildings, and outdoors anytime physical distancing from others cannot be maintained. The CDC recommends that people wear cloth face coverings in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Cloth face coverings may help prevent people who have COVID-19 from spreading the virus to others. Cloth face coverings are most likely to reduce the spread of COVID-19 when they are widely used by people in public settings. Please be assured that NRCC will work to promote fair and unbiased treatment of all who may be affected by COVID-19, and that NRCC is committed to avoiding stigmatization of vulnerable populations, individuals who have contracted COVID-19, and other affected persons. Remember, to be most effective, face coverings should be worn properly. In conjunction with CDC recommendations, wash your hands before putting on your face coverings. Place the mask over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face, and then make sure you can breathe easily. The college is enhancing campus routine cleaning services with additional cleaning and disinfecting activities in all areas. Any space that has a higher level of use or occupancy will have a higher frequency of cleaning. High-touch areas such as door handles, light switches, elevator buttons, etc. will be cleaned with EPA-approved disinfectants. Horizontal work surfaces, tables, desks, etc. will be disinfected in the same manner. We ask that all members of the NRCC community share responsibility for cleaning and disinfecting your own personal space. Please keep your workspace clean and hygienic. Cleaning is just one part of a larger strategy to prevent exposures. It's an important practice, but your best defense against COVID-19 is good personal hygiene. Specifically, please be sure to wash your hands frequently for 20 seconds and avoid touching your face, eyes, and mouth throughout the day. Anyone can unknowingly acquire and/or spread COVID-19. Everyone within the NRCC community has a role to play in slowing the spread of this disease, protecting yourself and our community. Please help to maintain a safe and healthy campus by maintaining good health and well-being, get adequate rest, maintain a healthy diet and exercise, wearing a face covering when on campus, washing your hands frequently throughout the day after leaving a group setting, after blowing your nose or coughing into your hand, and especially after removing your face covering. Using hand sanitizer at provided stations on campus. Reporting potentially unsafe conditions. Remaining home if sick or suspect exposure to COVID-19 and reporting suspected or confirmed illness to the college. And observing physical distancing guidelines and public health and safety precautions. Despite our individual and collective best efforts, there is a risk of contracting COVID-19 as our region and nation continues the process of reopening our institutions, businesses, and country. It's important that we acknowledge the risk and take steps to prevent the spread of this disease. One of the most effective ways to prevent the spread of COVID-19 is to remain home when you are sick and report your illness to NRCC. If you suspect that you are sick or have been exposed to COVID-19, stay home. Most people with COVID-19 have mild illness and can recover at home without medical care. Get tested. It's important to confirm if you have COVID-19 so that you can take appropriate precautions and receive medical advice. It's important that you take care of yourself, stay in touch with your healthcare provider, and follow their instructions. Call your doctor's office before you seek medical care. If you feel you are experiencing a medical emergency, call 911. To reduce the spread of this disease when you are sick, stay home except to get medical care. Avoid public areas. Avoid public transportation such as shuttles, ride-sharing, or taxis. Do not participate in group activities. If you must go in public, use a face covering. Notify your supervisor. Let your supervisor know that you will not be able to report to campus. Reporting your illness or suspected COVID-19 exposure is a key responsibility for protecting the NRCC community and will assist in limiting further spread of the virus. Reporting guidelines apply to all faculty, staff, students, and contractors. If you are diagnosed with COVID-19, you will be asked to identify anyone you have had close contact with during the time you have been infectious. The college is partnering with the Virginia Department of Health New River District to notify students, faculty, and staff of suspected or confirmed COVID-19 illnesses. So, we need your help. The college must know if you become ill or suspect that you have COVID-19 in order to help others take appropriate precautions and to prevent the spread of this disease. Details about NRCC's plans and precautions for returning to campus are outlined in the NRCC reopening plan and are also available online at www.nr.edu/CIU. This plan contains more detailed information about the precautions and procedures discussed in this training. Please reference this plan if you want more information about how NRCC is responding to the COVID-19 pandemic. College leadership is monitoring this situation and adjusting plans and procedures accordingly. The most current information about the college's precautions and reopening efforts can be found online at www.nr.edu/CIU.